Ready? We can start?
Yes.
Okay, great. So good afternoon, members of the press, and welcome to our daily COVID-19 briefing for the country. This is the briefing from the National Emergency Response Committee on coronavirus, an update on the COVID-19 situation in the country and the various response measures as at today. Since coronavirus disease struck our country, it has made the lives of many Kenyans unbearable. However, we are glad, as a nation, as a community, we have been able to make steps towards fighting this disease head on. This means that different Kenyans have ensured that they strictly adhere to the containment measures that we here at the ministry have issued to keep their loved ones safe and secure. However, for many of those who have contracted the virus, I'm glad to note that most of them have sought medical attention in an expedient manner. And we believe part of this good health-seeking behavior by Kenyans is why we have been able to register many recoveries in the country. It is, however, unfortunate and regrettable that in some instances we have lost lives, and we continue to do so every day as a result of this deadly virus. This is one thing that saddens us. We are, however, doing everything within our powers to ensure that no lives are lost. All lives are sacred, and no human being has the right to die from this disease, or indeed from any other, when we can do something to make a difference. And so, fellow Kenyans, what even breaks our hearts more is when we lose healthcare workers. One life lost is one too many. This is not to suggest that all other lives don't matter. Far from it. What must be understood is that our healthcare workers, in all cadres, be they nurses, clinical officers, laboratory technicians, administrative staff, doctors, all those working in the health sector are our frontline soldiers who put their own lives at risk in order to save the lives of others. And as we have stated over and over again, we will not tire. I will not tire. Government, the Ministry of Health, will not tire in protecting the lives of healthcare workers. And indeed, the Ministry of Health attaches great importance to the welfare of our healthcare workers in the country, and we are doing all to be able to ensure that they are well taken care of. We do note that indeed, as we have said many times, these are our frontline soldiers, and indeed we are at war with the COVID-19 virus. Fellow Kenyans, we have taken note of the concerns raised by healthcare workers, and we continue to engage them in order to find amicable solutions to the issues of concern that have been raised. Just last week, you may recall, officials from various unions held meetings with the ministry's senior management to address any outstanding issues. We do take note that we've been able to address some of these issues, and indeed, there are outstanding issues that require further engagement with other stakeholders in government, and we would like to assure the country, in the same way that we have managed to put all government employees on the comprehensive plan with NHIF, the other issues will be addressed to their logical conclusion. This requires continued deliberation in an enabling environment in which services continue. And to this end, we would like to take the opportunity to thank our doctors under the umbrella of the Kenyan Medical Practitioners, Pharmacists and Dentists Union for calling off their strike in order to give dialogue a chance. We appeal to all healthcare workers, be they clinical officers, nurses, lab officers, to equally do the same. A pandemic such as the one we are facing is equal to a war. And indeed, our healthcare workers are our frontline soldiers on the ground. And so we need to work together in solidarity to ensure that our people, Kenyans, get the much needed medical attention they so much require, because leaving them without this attention would be leaving them vulnerable to attack by the enemy that is COVID-19. The Ministry of Health will endeavor to ensure that all healthcare workers employed under the Universal Healthcare Program and those on short-term contracts are paid their dues in good time. Indeed, this issue has been raised, and currently our team is working on it. We have 117 doctors hired under this program. And as we do the counts and checks and balances, we have 15 more remaining who have outstanding dues, and we are working to endeavor to ensure that their salaries and arrears are paid. Of over the 9,000 healthcare workers hired under the UHC program, approximately 8,600 of them have been paid their dues, including all their arrears for the period worked. At the same time, the Cabinet Secretary for the Ministry of Health has asked for a report on the status of all healthcare workers hired to assist in the fight against COVID-19. And the ministry shall be sharing this report over the next few days. On the personal protective equipment, the PPEs, counties have been advised to acquire the commodities at KEMSA at the prevailing market rates. In addition to this, the ministry has distributed to all counties these life-saving items from donations which we have received from friends and well-wishers. And the criteria for distribution of these kits has been determined by the disease burden in the various counties. And this will continue with every new lot of donations we receive. We shall continue to expedite the distribution of those kits to the counties. Now, turning on to the COVID-19 statistics, today 521 people have tested positive for the virus from a sample size of 4,721, tested within the last 24 hours. This therefore brings the total cumulative load to 89,100 as the number of positive cases in the country. In terms of the cases that we've reported today, 504 of these are Kenyans, whereas 17 are foreigners. In terms of gender, we have 315 that are male, 206 that are female. The youngest is a 3-year-old baby, while the oldest is 90 years old. We have provided a disaggregation of each county by sub-county. In terms of the highest counties that have the highest burden, today we have Nairobi with 191, Kilifi with 93, Kiambu with 32, Busia 28, Uasin Gishu 22, Nakuru 19, Mombasa 17, Nyeri 14, Kajiado 14, Bungoma 13, Kirinyaga 11, Tana River 11, Kericho 9, Kisumu 6, Trans Nzoia 6, Makueni and Embu and have 5, Laikipia, Kitui have 4, Nandi 3, Siaya, Murang'a, and Kakamega and Isiolo all have 2 cases. Machakos, Tharaka Nithi, Taita Taveta, Bomet, Nyandarua, and Kwale all have 1 case. Again, we continue to provide you with a sub-county disaggregation for each county, highlighting to you the different areas in terms of the caseloads. In terms of our recoveries, 425 patients have recovered from the disease, 330 from the home-based care program, while 95 have been discharged from various hospitals. with total recoveries standing at 69,839. Sadly, today, we've lost 14 patients who have succumbed to the disease, bringing the total cumulative number of fatalities to 1,545. And our sincere condolences go to the families and friends of those who've lost their loved ones. Currently, in terms of admissions, we have 1,102 patients admitted in various health facilities countrywide, while we have 8,016 on home-based isolation and care. For ICU care, we have 71 patients. Out of these, 31 are on ventilatory support, 39 are on supplementary oxygen, 1 is on observation. We have another 66 patients separately on supplementary oxygen, out of whom 58 are in the general wards and 8 are in the high dependency unit. We do thank you and we welcome questions.
My name is Chimtai Goyen from Citizen TV. I have a few questions. I'll say 2 or 3. The first one you'd want to know is, I wish the Cabinet Secretary was here possibly to respond. But many would want to know, did the Cabinet Secretary lie to Kenyans when he said he had written a letter to KEMSA directing them to release the personal protective equipment, and yet KEMSA says no such order has been given? So maybe what is the status of that? The second one is, with the looming crisis by the Kenya Medical Practitioners and Dentists Union, today they have said they have 13 days left for the government to address the grievances. Do we know a tentative date when a meeting has been set up by the various officials involved to try and avert the strike, and when these issues will be addressed? And following the death of Dr. Magusu yesterday, and there are many more healthcare workers that are dying, not just doctors, nurses, even clinicians. Many feel like the government is really unwilling to protect the medical workers, and hence now this call by the health workers that if nothing is done, they're now fighting for their lives. So maybe from the government position, it appears that there is money to fund other activities, for instance, the Building Bridges initiative, the proposed referendum, but no money to fund other government initiatives. Thank you.
Do we have any other question? Okay. Thank you. The first question touches on the issues of PPEs. And I think you've asked, did we deceive Kenyans when we said that we are in the process of ensuring that these PPEs are distributed to the counties? What I can say there is that, one, this process is actually underway. We've had discussions with the KEMSA management to be able to come up with a modus operandi of how these PPEs will be able to get to the counties. And one of the things that we have to do is ensure that we have endorsement at Cabinet in form of a Cabinet memo. And so that process, I'm glad to report, is currently underway. In fact, the memo has already been dispatched to Cabinet and should then go through the processes and ensure that it is sanctioned. Additionally, it becomes important to remind you all that we continue to receive donations in terms of PPEs. Most recently, last week, we received kits for 6 counties, of which I was involved in their distribution. And so these donations that come in are issued to the counties for them to be able to have available kits. We have also gone further and given allowances for county governments to be able to procure PPEs, should they require them, outside even of KEMSA, meaning there should be no reason why a healthcare worker should not have a PPE. We've also held discussions with the healthcare workers themselves. As early as last week, we had discussions on PPEs, and we were able to listen to them when it comes to the PPEs. What are they asking for? And these items are available. I can tell you we were able to do assessments of exactly where shortages may be, and those gaps that have been identified are in the process of being plugged. In terms of the union, indeed, we are in discussion. And I must say, I do thank the union officials, really, for coming in and for discussing with us. Again, just last week, we've engaged with all the different unions. They've shared out the issues that they have, issues touching on comprehensive cover. We've been able to secure that for the civil servants in national government. Additionally, county governments have been able to secure those. I am aware there are a few counties now who are working towards their budgetary processes to avail funds for this. And I think on that regard, it's an issue where we say we've at least reached 90% when it comes to solutions. In terms of the other issue raised for PPEs, we've just discussed that. We're endeavoring to avail all PPEs to our healthcare workers, particularly healthcare workers who are serving in the COVID-19 units. We are aware, of course, COVID right now, having been in the community, we can have these cases presenting even in outpatient centers and in other departments. And so we're ensuring at least the bare minimum of an N95 mask and a visor is available for our healthcare workers. In terms of allowances, again, this is an issue that is under discussion, and we've mentioned today in our statement, if there's an issue that can be dealt with now, I want to give you the highest assurances it has already been dealt with. And so whatever is pending are issues that require engagement with different stakeholders, engagement with SRC, engagement with National Treasury, engagement with different stakeholders to be able to mitigate that issue. Government is duty-bound, and it acknowledges it is duty-bound to take care of our healthcare workers. And so if there was something that we could ultimately take care of immediately, we have done that. Anything that is pending, particularly on the allowances, we are dealing with it. We are looking at the estimates. We're trying to look at the progressions in terms of SRC. We're trying to look at how all those can be moderated. And that is why we are asking that we continue with these deliberations. We've had issues in terms of NHIF. Again, I'm glad. Just yesterday, we received a report from COG that they are covering all their healthcare workers in terms of NHIF to ensure that workers can seek medical services when they get ill. And I can tell you, discussions are underway for those 2-3 counties who may not have bridged that gap to ensure that that gap is bridged. And yes, indeed, losing a 28-year-old is regrettable. It's actually heartbreaking. We've seen the concerns in the media. We've talked to the union members. We've talked to friends of the Daktari who passed on. And we are well aware of the heartbreak that they are going through. And so we're in discussions to ensure that the family is able to get the aid that they require, but additionally that we're able to ensure that this is not a situation that recurs amongst other healthcare workers. And so all these issues, we are all quite well seized of them and are working on them. And just to give you the highest assurances, each and every complaint that has been raised, that which can be dealt with today has been dealt with. That which requires just a simple stroke of a pen has been dealt with. And that which requires deliberation, engagement with stakeholders, we are working on it. You've asked for timelines. Again, we've reached out so that we can be able to agree. We've even taken preemptive steps to be able to do estimates before we have those meetings, so that when we're on the table, we have discussions that can actually come to a good, logical conclusion. And so really, in terms of ensuring our healthcare workers are protected, it is something that we take very seriously as government and as the Ministry of Health. Do we have any other question? Thank you.
My name is Carlton Juguna. I'm a digital artist, animator. My main interest is doing